My name is Henshaw. I'm a sports medicine and shoulder specialist here at Danbury Orthopedics. And one frequent question, or question that almost always comes up when I'm talking to patients, is about not just what their diagnosis is, but what can I expect afterwards. So I treat ACL tears, meniscus tears, shoulder surgery varieties, whether it's instability, shoulder replacements, or rotator cuff repairs. And sometimes the easier part of the discussion is, oh, you've got something torn and injured, because people have pain, they understand, they've read their MRI report, they understand that something's broken and that it needs to be fixed. But what they don't understand is, what does that mean for them from sort of beginning to end? What is the surgery like? How long, when can I drive? When can I shower? When am I going to be able to use my extremity, whatever is being worked on? That's where I think the most valuable part of the conversation is, because the well-informed patient who knows what their expectations should be generally are much more comfortable going into it. There's a lot less anxiety, and they tend to do a lot better than those that are sort of concerned, they're not sure what's going to come next. So that's where I focus a lot of my conversation on after they've made a diagnosis. For instance, if you've got a rotator cuff tear, the day of surgery, you're going to meet the anesthesiologist, you're going to get a nerve block, they're going to do it with sedation, so you're not going to feel anything. The surgery takes as long as it needs to. It takes about 45 minutes, and then you go home. For about 20 hours, your arm is paralyzed, which is terrific because you don't feel anything. But you can shower the next day. Most people are driving within about 10 days to 2 weeks. It depends on what's been done. And then you're back using your arm pretty well by about 2 to 3 months, but you're doing physical therapy all along. So those are the conversations that I talk about with people with these injuries. The diagnosis can be sometimes pretty obvious and pretty understandable, but what's not understandable for most people is, what does that mean on my life in the short term? And that's what I like to focus on.